guys, back again here. We're going to just talk about now the different movements that can happen with the cranial bones. So we're going to talk about 4 different things. So you can have either a cranial torsion, a cranial side bend, a cranial shear, or a cranial strain. So the first one we're just going to talk about is side bending. So basically what we're talking about is the occiput and the phenoid bone. So what happens with the phenoid bone, it basically is side bending to either one side or the other. So it's basically all we're going to do is same thing with our hands. We're going to just place them on the head like so, and on the phenoid bone, and then we're just going to feel which 2 fingers go higher or lower. Is this finger going down or this finger on the other side? Okay, and it's very simple to feel. You can also feel where we go back to our common vault hold. And then we're just feeling which hand is dropping. So what you're going to do is you're going to feel your hands kind of move out to the side. Okay. Second one we're going to talk about is basically a torsion. So that's basically what we're doing is we're talking about how the phenoid bone is twisting. So it is doing this sort of motion. What you might feel, it might twist more on one side. So you might have a side bend with a torsion, or a side bend with a torsion on the left. So same thing, come into a vault hold here, and then we're just going to feel which hand is sort of moving inwards. So it's kind of doing this motion. So when you feel on Shannon here is she's just rotating, this hand wants to come forward. So she's got a bit of a torsion happening on this side. Next one is a shear. So what is happening is the phenoid bone is actually shifting out to the side. So it's more in this position. So it's actually, there's been some sort of impact or something placement which is shifting the phenoid bone over. What you'll feel with your fingers is basically the fingers will be coming in to one side. You won't have the bending or one side kind of lifting the other. You'll actually feel your fingertips drift in and out. And exact same thing, you're just putting your fingertips on the phenoid and then you're just feeling if that cranial bone is moving in or out. Okay, so like I said, side bend, torsion, shear. Okay, the next one we're going to talk about is a strain. Okay, so the strain is going to happen where it's going to tip a little bit more forward and then have the twist. Okay, so same thing, come in through here, and you're just going to feel where the fingers are going to go. So what you're going to feel is more of an opening, and then it'll actually close in, like this. Okay, so those are the different 4 impacts that can happen with cranial bones.